Yes, okay. So let me introduce ourselves. So I'm Dr. Mumta, this is Dr. Atta, and today on the Abbey House Dental Podcast, we're going to be talking about one of our most popular treatments, which is smile makeovers using Invisalign Clear Aligners. But before we kind of go into all the details, Atta, just tell us about kind of how you got into it, how long you've been at Abbey House for, and that.
I actually joined, during COVID, so April 2020, and I think that's when there was like a bit of a boom in, smile makeovers and Invisalign, and I think in the past we spoke about it. It's because at that time a lot of patients were all on the, Microsoft Teams meetings, etc. So constantly seeing themselves, and the money they'd save from not being able to go on holiday because of COVID, they'd be like, okay, we'll invest in our teeth. And I think it was around that time when I first came, so I've been about 5.5 years now at Abbey House, when I'd only done one or two cases at that point, so I'd barely done any cases. And then I think we had a conversation, we were like, okay, this is something we're getting lots of patients are interested in it, let's see what we can do. So then, since then, I think I've just, majority, I'd say 90-95% of the treatment I'm doing is just literally smile makeovers, so with Invisalign, bonding things at the end. So, like I said, I think I started off with like two, 3 cases before I joined, and now 350, 400, something in about three, when I first went Invisalign only, I guess, was about 3.5 years ago. So
I think collectively we've treated thousands of patients from like Staffordshire, Stoke, Rugeley area, and quite lucky that we've been actually recognised in the top 1% of providers in UK and Europe. But as part of that, I think there's a few kind of insights that we have that we could definitely share with everyone today. And I think when you said that, you noticed people were coming in, they were looking to straighten their teeth. I mean, 100% people are looking for a straighter tooth outcome, but in your experience, was there kind of, what are the kind of core reasons people are coming to see you? Again,
like you said, the main reason is they just want straight teeth, but a lot of, when you sort of delve into the science or almost the psychology of the patient behind it, a lot of the time it's because they lack a bit of self-confidence, or the self-esteem a little bit, and they sort of don't want to smile as much, or they're hiding the smile. So sometimes the reason is obviously aesthetics, but because of how it makes them feel, they feel more confident, they feel their self-esteem improves. So I've found the initial reasons I want teeth straighter, whiter, what have you, but when you delve deeper, it's because they're almost embarrassed and they want that uplift in their confidence, and that's probably what I would say the majority of my cases. And also actually sometimes it's because some patients have had this thought, I want straight teeth, but they've never taken the plunge. Because we do so many, we've got so many good, really amazing stories and stuff, patients hear word of mouth, etc., and then they'll take the plunge because they have that confidence in us. So they think, I've always wanted it, not been sure, but these guys can sort it. So then I've noticed that a lot of patients are just from word of mouth referrals now that we're getting. So I think they're probably what I've noticed over the 3-4 years now.
I mean, it is amazing. I think when they first come in, they're so anxious, and I think, like you said, some of them are. It's a barrier for them because they're almost worried about how they'll be judged when they come in, and I think it's for us because we've seen everything. We've seen simple to really complex, and I think to just be able to help them through and be able to, like you said, a lot of it's confidence. Smile is something that they can, even without any makeup, anything on, just a beautiful, confident smile. It just boosts you, right? I think for them, it's like, you can understand, and I do think it's a very powerful tool, but I think, like you were saying, for them, it's making that initial, taking that plunge. So, when a patient is looking to take the plunge, what things would you say help build trust for the patient along the journey? So say someone who's just been, bouncing the idea around in their head, what kind of things would they start looking for in clinics for them to understand that this is how you can build trust in the process. Like, what things do we do at Abbey House?
Yeah. So again, I've sort of mentioned it a little bit. Word of mouth, I think, and the experiences we've had, the patient testimonials, that side of things, the research, if patients look into it, especially Abbey House, they'll see all these amazing stories, and they'll see from there that actually these guys care.
Yeah.
So I think that's one of the biggest things. It's not a case of, I found anywhere at Abbey House, it's not just we get a lot of patients because they're just in, out, by.
Yeah.
A lot of the cases because patients, when they see us, they meet us, the workflow that we have in place, you don't just see the dentist, you see lots of team members, from hygienists to the treatment coordinators to us, and the level of detail, the precision, the care we put into everything.
Yeah.
I think it's different to other practices, and that I've worked in anyway, and I think patients can resonate with that, especially the ones that are nervous, the ones that are, have been self-conscious about it for a while, because that is something that they want to know that they are going to be looked after. So I think at Abbey House especially, I'm going to be biased, but I think everyone does care.
Yeah,
and everyone
we do.
Genuinely wants the patients, the same result for the patient that we want. We want the patient to have that, and I think we've really enjoyed the journey. We see the patient so regularly from the start to finish.
You really see that they become friends, and it's the person that you are treating at the beginning to the person that leaves at the end. It's like a different person, isn't it?
Honestly, and like I've recently had a baby daughter now. All my patients are coming in and ask, how's baby? So like we are, like genuinely with our patients, you can class them as friends because we know a lot about each other. So I think that side of things at Abbey House, we do genuinely care, and that's a big thing. And when it comes to the actual treatment itself, the experience we've got, not just myself and yourself, but the team, everyone's got lots of experience. We bounce ideas off each other, there's peer review and things like that. So we are at the top of the game, but learning. I mean, I've just recently completed a diploma, you've done a diploma, there's a dentist, so we've got orthodontists on board, so we've got all the tools, so
I feel like as a pool of people, we've got a lot of talent between us.
Definitely.
And I think that in terms of when a patient comes in here, even if it's something that I feel that I've got a limitation in, I know there's someone else in the team that can see that through. But from a patient's perspective, what if a patient was to come through the doors today? What would their journey look like?
So normally they will have registered some sort of interest either through a phone call or online on the website. They might have booked in. When they first come in, a patient, they'll come in and see either the dentist initially or one of the treatment coordinators. It's very relaxed, very chilled out. It's just a getting to know each other sort of consultation, and it's a case of just sort of figuring out what the patient's desires and what our desires are, and then it's a full examination, full checkup, x-rays, everything. So we'll do the full everything that you would expect generally to be done. We'll do that, take photos and use we'll do a 3D scan of the patient's mouth, so we get the the top of the top equipment.
What, in your opinion, that smart simulation that you get to see, how powerful is that for the patient?
It's brilliant, honestly. I we do it so often, but even I'm shocked by some of the results. Even sometimes I'm like, wow. But it's such a powerful tool because patients can visualise what their teeth can look like. I don't know about you, I've had a couple of patients that have actually broke down crying. I don't know if you've seen that.
I think, when you've done because nowadays, you can actually record the patient talking without doing anything. And I think for them to see a simulation of what they could look like in the future, and it's actually quite on point, really, isn't it? Like in terms of accuracy, what is doable and predictable. And I think them just being able to see that version of themselves that they've had in their minds for so long, that actually this is achievable. I think we both have had emotional moments with patients, isn't it? It's quite.
And I think that tool because they've obviously introduced the video side of things recently, haven't they? It's so good, and but yeah, like you said, like I said, it's very powerful. Patients love it, and it's really it's a game changer because, like you said, it's almost patient can actually think, okay, wow, that's going to be my day to day, and it's so nice for them to see. So that tool's great, but the software, the ClinJet, all of it's brilliant, isn't it? And we can play around with it. We can show patients this, and we can do multiple plans. It's so good, honestly. Yeah.
Amazing. So one of the questions we get asked a lot is the difference between traditional braces, like the train track braces and clear braces.
Yeah.
And how would a patient be able to decide which one's better? Like when would they, when they come and see us, what things are we looking at?
Yeah.
Because not all patients are suitable for clear aligners, like Invisalign. And there have been cases that me and you both have seen where we think, you need another type of device to help you.
Yeah.
So just talk from a patient's perspective, what kind of things do they need to be aware of?
I think when we're looking at the differences, most obvious differences between clear aligners or Invisalign and fixed braces is the aesthetic. So clear aligners are virtually invisible, then you can't really see them. They're very discreet, whereas the fixed braces obviously with brackets and wires, it's a bit more obvious. So that's probably the most obvious sort of difference. I think other differences that may affect patient decisions is a little bit to do with the removal, the clear aligners and Invisaligns are removable, so you can take them out, it's easy to brush, eat, things like that. From a patient's perspective on which one is probably better suited or for the patient, it comes down to a little bit about the complexity of the case.
Yeah, 100%.
So the more simple or moderate cases, and even some complex cases, majority of complex cases actually can even be seen under Invisalign. It's so advanced now. But I'd say the cases where we're umming and ahhing, is this an Invisalign or a fixed brace? That's probably where I would say, okay, well, if I'm thinking about either or, that's probably where I'd say maybe see if the orthodontist for the fixed braces. So I guess it depends on the complexity and also what you're trying to achieve. If you want the perfect bite and the perfect smile, then you might be better off in the hands of the orthodontist who predominantly do fixed braces. Whereas if you're happy with accepting the bite because you can function, but you just want a really good, nice smile, then Invisalign will work really, pretty much on all majority of cases. So I think when I sort of see which one to go for, I normally think, okay, this is probably a bit complex. That's where I suggest the fixed.
And I think that's where our expertise really comes in, isn't it? When the patient comes in for the assessment, and that's when we're doing all the kind of the due diligence, checking their bite, checking all these different factors. That's where they can really hone in on our skills and be able to kind of utilise us in guiding them through the process of, actually, your case, to get the result you want, it would be actually better developed by using, clear aligners or by going on having fixed braces. In terms of speed of treatment, is one faster than the other in your opinion?
I think generally Invisalign is probably faster, but again, it does depend on who's doing the treatment a little bit, because again, the expertise we have, we know how to do things, certain movements quicker, or we know we can do that's not relevant or needed, etc., etc. But also I think it comes back to the complexity a little bit as well. Again, the more complex is probably where you're going to see fixed braces. It takes a bit longer because it's more complex. In Invisalign, we can sort of treat the milder and moderate and sometimes severe cases, which are generally quicker. So I found that Invisalign is quicker than fixed braces. I don't know what you're thinking.
No, I agree. I think there's some cases that we can treat a bit faster with clear aligners. But then again, it's case dependent. It's the clinician dependent. It's on how you prefer to. Because at the end of the day, we all just want predictable results. So kind of from a patient's perspective as well, one of the other questions we get asked a lot is, are there things that can go, wrong with aligners that they need to be aware of? So one of the most common things I normally educate patients on is you need to be committed to wearing aligners, 24/7 really. You're only taking them out when you have something to eat or brush. And I guess if they lose that momentum, that's when it may take a bit longer to achieve that desired result. whereas, you know, with fixed braces, obviously it's put on the teeth.
Yeah.
They don't have to worry about anything
Yeah.
else. Everything's kind of taken care of.
Yeah.
But because it's a clear brace, I mean, what do you think about that?
Yeah.
Them wearing, you know, the compliance issue.
Yeah, I think the compliance is a big factor. So you have to be committed. Like, it's got to be part of your life. It becomes a lifestyle thing, but not just a you know, like a. Some patients see it as like a way of, like I said, the lifestyle. But some patients see it as a chore. So
Yeah.
it's the patients that see it as a chore might find that their compliance or their might dwindle a bit quicker or might dwindle, but I definitely agree with that, the compliance side of things. The more compliant you are, the higher the chance of success for you. Some patients, like, you know, they get to the end of their aligner journey and think, oh, my teeth aren't perfect, but then if you ask them, okay, maybe I took them out a bit longer than I should have, etc. So that's where, you know, refinements and additional aligners, things like that come into it. But definitely compliance, the 22 hours a day, if you can nail that, you'll be completely, it's not difficult.
Yeah.
It's just you wearing trays,
Yeah.
taking them out to eat, drink,
That's
pop them
it.
back in. So it's
Yeah.
simple, it's just
Yeah.
committing to it, I'd say.
Yeah, definitely. I mean, obviously you've treated hundreds. I've treated hundreds.
Yeah.
Do you have any kind of patient stories that really kind of resonate with you, or like, you know?
Yeah, so yeah, I've had lots of success stories, to be fair. I think we were just talking a little bit off before we started about some of the more complex cases. So I think some cases are so severe that, I say so severe, so not severe enough to see the specialist, but severe enough that it's affected patients, you know.
Personally, so for them.
Yeah. So I've had a few patients that have started off the journey, but they were umming and ahhing, they weren't sure. At the consultation, at follow-up appointments, they've been in tears because the smile has affected them that much because they don't like their teeth, and then they've taken the plunge, lots of help, support, hand-holding from us, and by the end the teeth are better than what they wanted and what they can imagine. So I've had some cases where we've had to actually take a couple of teeth out here and there, and it's daunting for the patient, thinking, oh wow, my teeth, I've got to take it. But when they see the end result, when they see what, you know, they get locked in that actually this is temporary, you know, difficulty for that final long-term stability, long-term aesthetic result. They're locked in, and the end results, honestly, the end they're crying as well, but
we're crying with them, isn't it?
And I think the sort of those patients, those difficult cases, they're the ones that you become so close to, you know, patient-wise, and you know, they always bring gifts or something, and it's so nice, and that's how you feel, you know, really like it's what makes this sort of part of the job so good. Like,
I think me and you get to do the good dentistry, isn't it?
Yeah.
And they actually come to us and leave with a smile.
yeah, exactly. And they won't stop smiling because, you know, so it's really rewarding, that side of things. So I think, just the bigger cases where they've gone, it's so nice to see.
I think for me, I had one moment where this lady came in, and you know, she just had a little one, and she'd, you know, after she'd had maternity leave, she wanted to go back into work, and all she was looking to do was just kind of take herself to that next level. So when she came in, and she was like, you know, she was really like, you know, how do you say it? Quite enclosed, shy. I think a lot of people are shy, right?
Sort of.
Introvert, that's it. And she came in, and so we showed her, we did the simulation, did all of that, and then over the course of, you know, so most Invisalign cases, I'd say, you know, would take between 6, 9, 12 months, right? So for her, she was with me for about 7 months.
Yeah.
And in those 7 months, the confidence she had, so it started off with, you know, covering her mouth, not smiling in photos, and to the point where she was becoming so confident. And it was so nice to see. She came back in, all suited and booted, and I was like, who's this? And she was like, she goes, this is the new me. I was like, you know, that's
so nice.
When you see the patient step into that glow, and you're like, oh my god, this is incredible.
It's so, honestly, so
it's life-changing, right?
And then, obviously, like you said, we do the nice part, isn't it?
Yeah.
They start off with maybe something they're not happy with, and then they end up with something they're really happy with, and we're seen as like, wow.
We're like superheroes.
So it's really nice, but like I said, because we care as well, it's so nice to see from start to finish, isn't it? Yeah. But I think sometimes you can get lost in just doing the treatment, but when you take a step back and you realise where the patient's come, I mean, you've seen it as well, you probably show before and after photos and everything. They're just like, I can't believe they were my teeth before, and that's it's so nice to hear.
I think that's the type of pictures me and you look at all day long, isn't it? This is how before and after. Like, wow, look at that.
My phone camera roll is my daughter and just teeth.
That's it, mine too.
So it's such a good.
I feel like my kids even know. They're just like, oh.
It's so lovely, honestly, and I think that those patients are also the success stories. I say, all of them are, but those ones that you remember stick with you. They're those patients. They're patient forever. They're never gonna, because they've got so much confidence in us. Yeah.
I think that's the one thing they do say to us, isn't it? Yeah. When you ask them, looking back now, what would you tell yourself?
Yeah.
Like, we wish we'd started.
Yeah, definitely. Yeah.
But yeah, okay, so it's for a patient then, let's wrap this up, for a patient who, is looking to take to step into that newer version of themselves.
Yeah.
What would you say to them? Like, what advice would you give them in terms of how to look for, a provider, what things are they looking for?
Yeah. I would always say, find a dentist or find a dentist, a dental team, a dental practice that has the experience, has got the expertise, and genuinely are there to help you, and that they care. Because it's one thing seeing dentists or a clinic or a dental practice and just going and becoming one of the patients, but it's another actually.
Or like that direct mail.
Yeah, whereas what I found at Abbey House anyway is they don't just have contact with the dentist, they see the whole team. They've got direct numbers to the TCO girls. If you've got any issues, any small things that you're worried about and you just want to just drop us a message, we're always going to reply, we're going to answer. So I feel like we're very approachable and we're available. So and like I said, the experience is another thing, that going to a dentist or somewhere that you haven't done a lot of treatments or this sort of stuff, it is, although we make it sound really lovely and it's still complex work. You need to make sure the person doing it knows what they're doing. So and I think the reviews that we get, I mean, they speak for themselves really, but I think you just need to have that confidence in us, and as long as you've got the confidence, that's where you need to go, I'd say.
Amazing, thanks Atta. And just before we finish, there was something I prepared.
Okay.
So obviously we like reading books here and improving ourselves always. So there is a book I wanted to give to you.
Okay.
It's called Atomic Habits.
Oh, lovely.
This is probably one of my favourite books.
Okay.
And as I was reading it, because you are such a, methodical human being, and everything you do is like follows the system, which is probably why your aligner cases are so amazing. But in this book, it talks about 1% changes. Okay. And I think that kind of goes hand in hand with what you do in life and changing people's smiles. Each aligner is doing kind of a 1% change, right? Yeah. But I really thought about you in this book, so I thought I'll give it to you, so you can read it too.
Yeah, amazing.
So
Spencer, I have actually had this on my reading list for a while.
Should read it.
Thank you.
Yes, I know. Right, you'll remember this conversation between us.
Lovely.
Things we do together.
Honestly,
isn't it?
This isn't even just for this. This is
I
know. Lovely. Oh, thank you, Mumta.
But you never thought we'd be doing this together, isn't
honestly,
it? Coming from a dental world, just doing general dentistry.
Yeah, honestly, because like I said, I started off doing normal, and then obviously now I'm doing so it's the journey that I've had itself is crazy. So no, brilliant. Thank you. I'll definitely have a read of this.
Yes. Great teamwork, Atta.